You're listening to Health Professional Radio with Wayne Bucklar. My guest today is Lisa Rath. Lisa's an epilepsy support worker with the Epilepsy Foundation and is talking to us today from Melbourne in Australia. Lisa, welcome to Health Professional Radio.
Thank you very much, Wayne. It's a pleasure to be invited and to participate.
Now, I wonder if you could give us a bit of a thumbnail sketch about what it is that the Epilepsy Foundation does, and then we might move on to diagnosis and treatment, if you like. Yeah.
Well, maybe if I just give some practical examples of the tasks I've been working on today, for example. And no 2 days are the same. I mean, yesterday I was working on our helpline. We've got a helpline that is open Monday to Friday, 9 to 5, and we get predominantly telephone inquiries and a lot from interstate as well from Victoria. We're not a crisis service, so that's why we're not open 24 hours a day. And that any inquiry, whether it comes via phone, email or drop-in, unannounced drop-in to our service, our agency, and we've got 2 offices in Victoria, one in Melbourne and one in Geelong. The intake worker rostered for the day responds, and the queries are incredibly diverse, and the people who contact us are very diverse, from doctors ringing us for the latest advice about what the national driving guidelines are, to grandmothers, grandparents ringing us, to parents of newly diagnosed children. So that is what occupied my time yesterday. But today, for example, I've been working with a family to develop an epilepsy management plan prior to some of our education and training staff going out to a school to do training, so that the staff have a much better understanding of that particular child's epilepsy and know how to provide appropriate support. And I've also been doing some work. We're running a forum for young people between the ages of 12 to 24 in the Melbourne CBD on Saturday, and a number of my colleagues and myself are going to be actively involved in running this forum to get a better understanding of what are the issues for adolescents and what services should we be providing. So it's a really diverse range. We have support groups, we run getaways. We had a very successful getaway for families with children with epilepsy under the age of 18 recently, had 16 families from all over regional Victoria and Melbourne, and that was a fabulous experience. So we run quite a lot of that sort of stuff as well.
It does sound like you lead a very interesting life there, Lisa.
It's incredibly diverse, and I have been with the Foundation nearly 26 years now, and even though it's one neurological condition, it is incredibly diverse. The job is never, ever dull.
And it is a condition that does present in a variety of ways and forms, isn't it?
It does, and no matter how hard we try to raise awareness in the community and to provide really effective education, people still have there's still a lot of misunderstanding, misconceptions about epilepsy in the community, and they still have a narrow understanding of what seizures look like and what epilepsy is. There's no doubt about that at all.
Now, Lisa, people who are coming or looking for your services, do they need to be referred or can they self-refer?
No, they can self-refer. In fact, we get lots and lots of self-referrals. We do have a referral form on our website for professionals to refer. So we do get a lot of referrals, for example, from disability organisations, because we've got some fantastic training packages that are targeted to different audiences, if you like. So we've got a disability package that's appropriate for people who work in disability supported accommodations or agencies providing day programs and respite, for example. We've got separate packages for training in schools. So professionals can refer, and we get lots of referrals as well particularly from paediatric neurologists. That's the Royal Children's Hospital in Melbourne, for example, and other neurologists. So yes, but people can self-refer.
Now, most of our audience are clinicians of one sort or another. We get about 95% of our audience are either working in acute care, doctors, nurses, allied health professionals, or in aged care. Is there a message you'd like them to take away today as a result of having heard you?
Well, I think I honestly think the need for referral to an organisation like ours when, for example, there's an emergency medication called midazolam that's commonly prescribed now for use in the community to when either seizures are prolonged or there's worrying clusters of seizures. And we have nurses on staff who train family members, professionals such as school teachers to administer this medication, but often the medication is prescribed in accident and emergency departments, but there's no thought about whether those family members need training. And so there's a lack of continuity in referral and pathways, smooth pathways between the acute hospital setting and the community-based setting with organisations like ours. And it's just something that I think both hospital-based services and our sort of service need to do a lot of work to improve. So that's one key message, trying to, don't forget we're out here and we can actually provide good support to people once they're out of hospital and back home.
Yes, and often having that information at your fingertips when you're having a busy day in A&E is a challenge. I have some sympathy for the people in A&E, but I do agree with you that those smooth pathways are critical to preventing your patient turning up back in accident emergency.
That's right, and a lot of the big public hospitals, I know in Melbourne, for example, we've got three big public hospitals that have fantastic specialist neurological epilepsy clinics. Now, my other message would be that please refer people to us if they identify that there are some ongoing issues. And often when people are interacting with the doctor, there's a limited capacity, there's limited time, there's a limited opportunity to provide really good support and information. And that's why people often contact us, or the person with epilepsy or a family member, because they need more time to digest what this diagnosis means, what impact is it going to have on their life, what limitations, if anything, might it impose. So this is where we can really work in a very complementary fashion with neurologists and hospital-based services like that.
Now, Lisa, in every occupation there are misconceptions, and it's my favourite question in every interview. What's the biggest misconception amongst your colleagues, clients, patients that, drives you nuts and keeps you awake at night?
I think there's a bit of my experience in terms of if we focus on hospital-based staff is there's a degree of scepticism, I think, that I've gleaned over the years from hospital-based specialists, for example, and staff, allied staff, about the value of a service like ours, a not-for-profit, that was really established by a group of parents about 50 years ago when their adult children were not receiving adequate services. So I think that's one thing that I think and that's probably partly because we haven't done a good enough job to establish relationships with all these key people to tell them about the breadth of services we provide. So I think that's a misconception that there's no point in, referring to an organisation like ours because what help can they provide and why would people need it? So I think that would be one thing. And I think, in terms of general myths and ignorance about epilepsy, people still think that it's a contagious disease in some quarters in the community, obviously not hospital-based staff. So, there are a lot of really entrenched myths about epilepsy that are really difficult to break down. I mean, a lot of people don't understand or don't realise that most people get very good treatment outcomes when they're diagnosed. And a lot of people think that if you've got epilepsy, you must have an associated intellectual disability or cognitive impairment. And that's not true for everyone with epilepsy.
Yes. Well, let's hope today that, having heard you, we might dispel some of those misconceptions a little bit. And certainly, given that lots of our audience are in a position to refer, we might hope that some of those referrals will be a little more forthcoming. Now, Lisa, what's the best way for people to get more information? Is it your website?
It is our website, which we're hoping, our website from my point of view is not the most impressive in the field, but we're actually undergoing a big rebuild of our website. So yes, if they go to our website, they can sort of navigate from the home page they'll see our contact details. There's a 1300 number that they can ring. or they can send an email so that we get lots of inquiries. The initial contact from people is often via email. If it's a professional listening and they think, well, this service may be useful, I didn't know about the Epilepsy Foundation, definitely referral forms on our website that are easy to find as well. And so we welcome contact from anyone, really.
And that website is www.epinet, is it? epinet.org.au?
That's it, Wayne, yes.
So I'll do that again because I always get into trouble from our listeners when they say, you didn't warn us you were going to give a domain name and we didn't have our pencils ready. So pencils ready, listeners, www.epinet.org.au. Lisa, thank you for your time today. I do appreciate you making yourself available.
Well, thanks for the opportunity, Wayne, and we'll look forward to having an increase in referrals from hospital-based services.
Well, maybe. My name is Wayne Bucklar, and this is Health Professional Radio. I've been in conversation with Lisa Rath, who is an epilepsy support worker for the Epilepsy Foundation. And if you've missed my conversation, I have good news. We have a transcript on our website. We can also have the audio archives on YouTube and SoundCloud, and you can find all of those at our website, www.hpr.fm. You're listening to Wayne Bucklar. This is Health Professional Radio.